Congratulations to all of you for holding your 8th annual conference on evidence-based medicine in Maine. By providing guidance to clinicians in the use of evidence-based practice models, you are helping to establish standards that will positively affect quality outcomes, benefiting both patients and the people of Maine. Your efforts are intimately connected to the future of nursing. I know one thing for sure: the future of nursing is the future of healthcare, and that future is now. It's an incredibly exciting time to be a nurse and to be part of the transformations underway in health and healthcare. You know that our health and healthcare system faces enormous challenges: an aging and sicker population, millions more insured, a primary care provider shortage, lack of preventive care, and skyrocketing cost. The system itself suffers from fragmentation and an emphasis on quantity of tests versus quality of diagnosis and treatment and prevention. There are a lot of changes we need to make to improve healthcare in our country and in Maine. The good news is that these healthcare challenges mean that policymakers, healthcare systems, opinion leaders, payers, business, and consumers are open to change like never before. We need to expand our system's focus and capacity. We need to increase access to care, improve quality, and contain cost. We need to make sure that coordinated health services are consistently provided in all settings, when and where patients need it, including at home and in the community. The Robert Wood Johnson Foundation wants to create a future in which all flourish in good health, where encouraging wellness is as high a priority as treating illness, where we all have access to high quality, reasonably priced health care. We envision a culture of health, where getting healthy and staying healthy is a fundamental value, right up there with life, liberty, and the pursuit of happiness. We envision a society where good health flourishes across geographic, demographic, and social sectors. And I believe passionately that nurses can help us to achieve this vision. As the largest segment of the healthcare workforce and the ones who spend the most time with patients and their families, nurses are vital to the successful transformation of healthcare. Nurses are at the center of many of the innovations we rely on to expand access, improve quality, and contain costs. And nurses with strong clinical and leadership skills can help to promote wellness, develop new models of care, manage care coordination, and help hospitals to reduce medical errors and rehospitalizations. That's why the Robert Wood Johnson Foundation joined with AARP, the nation's largest consumer organization, to launch the Future of Nursing Campaign for Action, a nationwide initiative in all 50 states and the District of Columbia to improve health through nursing. The campaign seeks to advance the recommendations in the landmark Institute of Medicine report, The Future of Nursing, Leading Change, Advancing Health. The experts behind this report believe that nursing must be prepared for health system transformation, and nurses must help to lead and shape this change. The report made a series of recommendations in 4 key areas. Nurses should practice to the full extent of their education and training. 2, nurses should achieve higher levels of education and training through an improved education system that promotes academic progression. 3, nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And finally, effective workforce planning and policy making require better data collection and an improved information infrastructure. Action coalitions comprised of a nurse lead and a non-nursing organization lead are working with many healthcare stakeholders to advance the IOM recommendations in all states in the District of Columbia. I want to thank those of you who have joined the Maine Action Coalition. If you're not already involved, I would love to have you join our efforts to improve health through nursing here in Maine. It will take all of us, consumers, payers, business, think tanks, long-term care, foundations, and everyone who cares about health care. But nurses are the heart and the soul of our effort, and you will play a central role in ensuring our success. Please go to www.campaignforaction.org to sign up and join the Maine Action Coalition. You've got great leadership here, and Barbara Hannon, Lynn Gagnon, Donna Dubois, Judy Tupper, and Judith Metcalf, and we need you to join them. We need your voices as well as your time and talents to succeed. We need your help to improve health and health care in Maine. It is every nurse's individual and collective responsibility to support this report and to help advance it. And so much that you can do as much part of everyday job. Nurse faculty and deans and directors, this is what you can do. Make sure that your faculty is teaching the IOM report in your school's classrooms. Encourage your students to continue on with their education and to consider roles in primary care or as nurse faculty. It's particularly important that you identify students who would make great researchers and teachers and mentor them. Show them resources, encourage them to pursue their PhDs and DNPs. We desperately need faculty to teach the next generation and conduct research. Conduct research to bolster the IOM recommendation. That's what we need. Make sure that your school is fostering interprofessional collaboration by offering joint classroom and clinical training opportunities. Integrate leadership theory and business practices across your curriculum. Make sure that your school reaches out to healthcare organizations in your community to design and implement simulation labs and clinical training settings so that more BSN students can be educated at one time and gain clinical experience. Nurse executives and leaders in practice, here's what you can do. Incorporate the recommendations into your organization's strategic plans. Promote nursing leadership at every level. If there's a new piece of technology being considered at your facility or a new quality improvement program that will be tested, make sure that nurses are involved in the decision-making process. Ensure that a nurse sits on the committee overseeing it. Make sure you mentor new nurses and get them to be leaders. Talk with your CEO about making sure that a nurse serves as a voting member of your organization's board. Encourage lifelong learning. Keep exceptional data on nurses' contributions so that you can prove to management that the contributions you are observing are in fact improving quality and promoting efficiency. Foster a culture of teamwork and respect, and consider launching a residency program or putting incentives in place to enable more nurses to continue on with their education. Many health organizations are implementing BSN hiring preferences. Offer tuition reimbursement for nurses seeking their BSN or MSN. You could also offer compatible work and class hour, paid sabbaticals, forgivable loans for service, pay for attending class, and web-based and worksite classes. Employers are also at the forefront of the innovations taking place. You know the skills and competencies that nurses need to have, so it's crucial that you weigh in. We need you to help to develop a forward-looking curriculum that incorporates the latest in health IT, financing, care transitions, care coordination, chronic care management, and more care moving to homes and communities. It's a time of change and a time of hope. The future of nursing is the future of healthcare, and that future is now. We can't transform healthcare without transforming nursing. We just can't. Our healthcare system and culture of health can only be successful if nurses are better prepared and able to practice and lead to the full extent of their education and training. And it's up to each and every nurse to stand up and lead, to usher in the future of nursing and improve health for the people of our communities and the people of Maine. Join us, won't you? Together, let's create a health system that provides accessible, affordable, and quality care to everyone in America. Thank you.